Like many conditions, diabetes is caused by your genes and your personal environment. You cannot change your genes, but you can modify your lifestyle. This is a condition affecting the endocrine system. The pancreas stops producing the hormone called insulin or produces too little. Or the cells in your body become resistant. This hormone usually unlocks the cells in your body and allows glucose to enter for immediate energy needs or is stored away to be used later. Blood glucose levels come mostly from the carbohydrates in the food you eat. Unless you have enough insulin, your glucose cannot be used and your blood levels rise. Untreated, this can cause long-term health problems. Once diagnosed, you are able to make different lifestyle choices and prevent some of the health risks. There are two main types of diabetes. Type 1, which usually affects young people, although it can occur at any age and develop very quickly. Type 2 develops slowly over a long period of time. The symptoms may not be noticed early, so the condition goes undiagnosed for years. It is usually found in middle-aged or elderly people but is increasingly being diagnosed in early adulthood and sometimes in childhood. It can often be treated with diet and exercise. Pregnant women sometimes develop a third type. Gestational. Each type has different causes, so they are treated differently. The symptoms are very similar and you may experience some of the following: dehydration and thirst, a need to urinate frequently, extreme tiredness, weight loss or weight gain, itching in the genital area or frequent episodes of thrush. Cuts and wounds may heal slowly. Reoccurring infections such as boils. Managing your condition. Your healthcare provider will help you find the best way to control your blood sugar levels. The trick to managing type 1 diabetes and to maintain the near normal levels necessary to stay healthy is to pay attention to your daily schedule. Learning to understand the effects of your lifestyle and adjusting your insulin to maintain your blood glucose levels in the range your healthcare provider and you decide on is really important. If you have type 2 diabetes, it should come as no surprise that lifestyle choices had a major impact in creating your condition. The first treatment strategy, almost always applied to 90% of people who are diagnosed, is a weight loss program and increased exercise or activity. However your diabetes is treated, you will need to know how much glucose is in your blood and what affects your levels. Your healthcare provider will explain when you should test your blood levels and what the patterns mean. One of the first things for you to learn is how to keep these levels within a healthy range so you can decrease your risk of developing diabetic complications such as heart, eye, kidney and nerve damage. You have a lot to learn and you are not expected to learn everything at once. It takes time to absorb it. I know I am pre-diabetic and will do whatever it takes to be type 2 diabetes free.